Hi, I'm Garvin. This telecast is on Cystrin and Ditropan. The chemical ingredient is oxybutynin. So what is oxybutynin used for? It's used for urinary incontinence and urgency and frequency in people with unstable bladder conditions. The condition may have no known cause or may be due to problems with the nerve supply to the bladder. For example, following a spinal cord injury or as a result of conditions affecting the nervous system, such as spina bifida or multiple sclerosis. It's also used for bedwetting or nocturnal enuresis, associated with an overactive bladder in children aged 5 years and over. Oxybutynin is used in combination with other non-drug therapy and only when other approaches have not been successful. So how does oxybutynin work? Oxybutynin hydrochloride is a type of medicine called anticholinergic or antimuscarinic muscle relaxant. It works by relaxing the involuntary detrusor muscle that is found in the wall of the bladder. The detrusor muscle can sometimes contract in uncontrollable spasms, and this is often referred to as having an overactive or unstable bladder. The overactive detrusor muscle can cause an increase in the number of times you need to pass urine, uncontrollable urges to pass urine, or involuntary leakage of urine or urinary incontinence. By relaxing the detrusor muscle, oxybutynin reduces unstable involuntary contractions of the bladder and thereby increases the capacity of the bladder to hold urine. This in turn reduces the need to pass urine. So how do you take oxybutynin? Oxybutynin tablets and liquid can be taken either with or without food. So what should you know before taking oxybutynin? Oxybutynin may cause drowsiness, dizziness and blurred vision. If affected, do not drive or operate machinery. Oxybutynin may rarely cause the pressure in your eyeball to increase. Contact your doctor immediately if you experience eye pain or a sudden change in your eyesight while taking oxybutynin. For example, the reduced ability to see fine detail or seeing halos around lights or blurred vision. Oxybutynin may reduce sweating, which can make you more likely to overheat in hot environments. If so, you have a high temperature or fever. Discuss ways to minimize this risk with your doctor or pharmacist. Oxybutynin should be used with caution in elderly people, children, and people with kidney or liver problems, people with gastroesophageal reflux, for example due to a hiatus hernia, and people taking medicines that can cause or worsen reflux esophagitis, such as biphosphonates, such as alendronate, and people who are constipated, and men with enlarged prostate gland, benign prostatic hyperplasia. Also in people with an overactive thyroid gland or hyperthyroidism, and people with high blood pressure or hypertension, people with heart disease such as heart failure, an irregular heartbeat, fast heart rate or angina, and people with disorders of involuntary nervous system. So can you take oxybutynin while pregnant or breastfeeding? The safety of oxybutynin for use during pregnancy has not been established. It is not recommended for use during pregnancy unless the potential benefits to the mother outweigh any possible risks to the developing baby. So seek medical advice from your GP. The safety of oxybutynin for use during breastfeeding also has not been fully established. It is not recommended for use by breastfeeding mothers. Again, if any doubt, get medical advice from your GP. So what are the possible side effects of oxybutynin? So they'd be feeling sleepy, dizzy, blurred vision, headache, feeling sick, constipation, dry mouth, dry skin, diarrhea, vomiting, confusion, dry eyes, flushing, inability to empty the bladder. So talk to your doctor, nurse or pharmacist if you want any more information about the possible side effects of oxybutynin. So can you take oxybutynin with other medicines? There may be an increased risk of side effects such as dry mouth, blurred vision, drowsiness, constipation and difficulty passing urine if oxybutynin is taken with other medicines that can have antimuscarinic effects such as amantadine, the anticholinergic medicines for Parkinson's syndrome, for example procyclidine, and the antipsychotic medicines, for example haloperidol and chlorpromazine, the antispasmodic medicines such as hyoscine and atropine and codeine. Oxybutynin may oppose the effects of the following medicines on the gut: cisapride, domperidone, and metoclopramide. So if you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.